You're watching the India Development Debate. I'm Tamanna Inamdar. Panic and fear are spreading faster than the coronavirus pandemic that now has over 20,000 people impacted and over 400 killed in China. Singapore has reported its first local transmission of the virus with 6 people affected. Back home, the state of Kerala has declared it a health emergency. Travel bans to and from China have been put in place in a number of countries as well. Now, as more and more news comes in of the virus spreading, important questions emerge. Is there even more panic because of China's apparent attempt to squash news of the virus or keep under wraps the true extent of the spread? Is the WHO, who has said there is no need for travel advisories, underplaying the situation, or are other nations like US, Australia and Russia overreacting? Of course, the most important question is India prepared for a possible spread of the virus, and what can we do to avoid it and stay safe? To speak on all this and more, I'm joined today by Dr. Sanjeev Bagai, Chairman and Managing Director of Nephron Healthcare, Dr. V.K. Monga, former Finance Secretary, IMA, and Shubham Pal, media professional from Beijing. Thank you to all of you for joining us today. Shubham, let me start by just getting a sense from you on the information flow. Are we getting the accurate numbers? Unfortunately, Beijing is not known for complete transparency. And that's the fear, because the numbers of those killed or affected seem to jump almost overnight and every night. Is that because it's spreading that quickly, or the news is being put out that slowly?
Yes, Tamanna, the thing is, at this moment, the situation is quite grim. As you mentioned, the figure, the death toll is, it's rising quite thick and fast. But yes, we have to trust the Chinese authorities, because initially they themselves have accepted that initially they were a little slow in tackling with the situation. But after that, the central leadership, they have they are in command at this moment. And since then, we can see that the relief operations and all kinds of efforts to contain this that's been expedited. And the figures we are getting is because of like last 15 days, that the incubation period for this virus to spread, that is over almost. Like 14 days incubation period is over. And already like there are so many, like there are 20,000 infected people at this moment. So that's why once the incubation period is over, so symptoms have started coming out, and you can see the number of victims also. The treatment is on, but those whose like immunity power or the body can't respond to the treatment are falling prey at this moment. So that's why the death toll is
joining us there from Beijing with all the latest without a mask. Shubham, you're brave. I don't think anyone is walking around in Beijing without a mask, but you are. I'll come back to you in just a couple of minutes for more inputs on what really is going on in China. Huge economic impact there as well. But Dr. Sanjeev Bagai, let me come to you on the key question. Do you think there is more panic, or is the WHO really underplaying it? Because, there is a bit of confusion here. I had a chance to speak to the WHO spokesperson just last week, really, and we've been tracking the story consistently on the show. And he said very clearly that there is a 2 to 4% case of fatality. At that point, they had not, still said this was a pandemic. They took their time in doing that as well. And now they say there's no need for these travel advisories. But countries are leaving nothing to chance. How do you see the situation? Which side is overreacting or underreacting?
Hi, good evening. I think the real picture is that there is enough data in the international medical circulating news that China actually knew about this in early December. In fact, there are some of the medical professionals who even mentioned this, and they were given gag orders. So really, it has spread in local provinces in China. The real incidence would be perhaps a lot more in China than what is being depicted for a variety of reasons. But I think WHO and CDC haven't actually played the real numbers, because it's sometimes difficult to capture the numbers, because this is going to present just like a common upper respiratory cold and cough or pneumonia. Also, there will be a lot of person-to-person transfer once the infection is disseminated into the community population, which is apparent now. It's present in more than 25 countries, and the fatality is crossing 425 mark, which is more severe than the SARS infection of the same strain and the MARS infection of the Middle East same strain. Once the infection is into the community, because the human being is not adapt and not immune and not able to fight this infection, it spreads very rapidly. This is a new infection. It's a new virus to the human body. The human body does not so far ever have antibodies to it because it's a zoonotic strain. It's an animal strain. It has great propensity to human being transfer. It's very virulent. And this infection per se, once it comes from a cross-species jump, that means from animals like snakes to mankind, it becomes more virulent. It mutates. We don't have a vaccine for it. There is no known treatment for it. It is just conservative, supportive treatment. And last and most important is that once this infection percolates down into the local community, because it's a droplet infection and hand-to-hand contact or any secretion contact,
right,
it can be devastating. We've seen case reports being reported in Singapore, in Hong Kong, in Toronto, in US, in Middle East. So we are seeing this infection all over the world.
You know, just to clarify, the WHO has declared it a global health emergency, but has made it clear, in fact, earlier this evening, that this is not a pandemic. Dr. Monga, can you explain to us why it's important whether this is called a global health emergency or a pandemic? What does it mean when we say the state of Kerala is calling it a health emergency? And the preparation really of the Indian medical system and quarantine facilities to make sure it doesn't start spreading here?
That's right. I mean, Dr. Bagai has just now enumerated the reasons for its very fast spread. Because, I mean, so much of travel, so much of international, national travel, I mean, the disease can be transmitted to any part of the world in a few hours also. And that is why WHO has held a series of meetings in the last few weeks. And they have come to that decision that, I mean, still not an endemic proportion, but definitely a proportion where people should be caring about it. The countries, the governments all over the world, they should be more careful because it transmits and then it kills also. I mean, even in India, you know, we have got 3 cases, confirmed cases. All over the world there are cases. And Dr. Bagai has just said that the incubation part is over. Yes, definitely it is over. But any new cases from person to person, man to man, which have become new cases now, they will have again that incubation period. So governments have to be very careful, and I think travel advisory to persons who are coming from China or going to China, I mean, that is a must. And the conditions prevailing all the world, I mean, it may not be panicky as such, but definitely you need to take full care, precautions, all facilities to contain the disease, for example, quarantine the disease, and all other facilities, they have to be
needs to take precautions, and we're constantly on your screens telling you what
time to work on these issues.
Yes, Dr. Monga, obviously everyone needs to take precautions. It goes without saying. What I'm asking you is about the preparation and abilities of the Indian medical health system. We have found right now some cases in Kerala, which relatively is known to have a pretty robust, you know, public health system. But that's the concern, right? Again, we have a situation with large population,
that's right,
a lot of crowded spaces, not necessarily, you know, the best awareness about, you know, even covering your mouth when you sneeze, so these things can spread. I'm talking about that level of awareness and capability. Do you think we're on the job right now?
I'm sorry, not up to that mark, because Delhi has earmarked some hospitals and containment beds, you know, and similarly in Kerala they have. But I'm afraid I'm in places which are smaller, where their international travel has been there, we don't have that much of facility. And tomorrow, for example, if there are thousands of cases, under investigation in Delhi, Mumbai or Kerala, wherever, the governments may not be able to cope up with such a high number of patients. I mean that I think preparedness, maybe the government is preparing, but as far as I know, we are still not prepared to take up an issue which may run into thousands of cases, which I mean the government has to take care. I mean, and what about the general awareness part of it, the public part of it, the government is still not, I mean, coming out and telling everybody on the street that avoid crowded places, do this thing while sneezing, don't
No,
touch
absolutely.
surfaces like
You know
this,
what my
and
concern is?
hygiene.
Yeah,
And
you know what my
hygiene is the
concern
most
is?
important part.
That with the lack of official clear information, fake news takes over. Dr. Bagai, I'm going to come to Dr. Bagai on this point.
Yes.
Our preparation now, what I have seen so far is from, the Ayush Ministry's handle that take your homeopathic shot to increase your immunity. Maybe it'll work, maybe it doesn't. But at this time, we don't have a vaccine. Do we have clear instructions? And then there's all kinds of theories coming about not having this and not having that, and people don't really know.
Yeah, there are internal medical advisories. I think the media is the best medium and platform, print and electronic, which is disseminating the information. All the newspapers and the TV channels are doing exactly what we should do. But coming back to the core point of what a common citizen in India can do, one is, of course, there is no acute panic per se. It's extremely important to keep away from people who have a cough or fever, keep away from people who are sneezing, strict hand washing, keep good local hygiene of your own self, avoid rubbing your eyes or putting hands in the mouth, because it's not only transmitted through aerosol, but also through the hands, through the eyes and the mouth. If you have fever or cold and cough or breathlessness or vomiting, headache, rash, body ache, consult the local doctor. Don't self-medicate yourself, because you'll be doing yourself more harm, and plus you may be actually promoting the spread of this disease to hundreds of people you may individually come in contact with. Yes, there is no vaccine and there is no medical treatment as an antiviral which has been isolated for this. It's primarily supportive treatment. But I must add, there is no country in the world which can ever be geared up as a community-acquired infection when such a lethal and invasive infection enters into the local communities. So what we need to do is to keep a very high level of suspicion, keep our medical systems intact, spread this message of awareness that you need to be careful and check the travel plans of the person when you're taking a history medically to make sure that which part of the world they have traveled from. And very important is quarantine the person for at least 2 weeks. That's 14 days, because that's the incubation period. The virus is very resistant and it can also remain dormant on surfaces like cell phones or doorknobs or on tabletops for 5 to 6 days.
Yeah.
So it's not only person to person, but it can also come indirectly from objects which may carry the droplet infections if a person coughs or sneezes. So it's a very high level of suspicion what we need. I don't think we need to panic. I think the Indian medical system is robust enough to manage the cases as and when we isolate them. We've done the correct thing to evacuate hundreds of students and other citizens of Indian originality from the China province.
Yeah.
Many countries have not been able to do it, or they are not interested in doing it. But I think it's important to keep our guard up and wait and pan this crisis moment through.
No, absolutely. Information and timely information is key to dealing with something like this. In fact, Shubham, let me come to you to just get an idea of what the information flow right now is in Beijing. We've all seen the story of Dr. Li, a very brave doctor in Wuhan, who was one of the first people to actually warn about the coronavirus. He was reprimanded initially by the Chinese authorities, and then they admitted, of course, that what they did was a big mistake. In terms of being transparent with what's going on, what is happening there? Is there a massive lockdown in public places? Can you describe for us what's going on in Beijing right now?
Yes, Tamanna. Actually, you have to see this picture. I mean, you can segment it, in two parts. One is Wuhan and the province where it's located. It's called Hubei province. So Hubei province, Wuhan, 16, 17 cities in Hubei province, including Wuhan, are completely locked down. All the public transport, everything has been like shut down at this moment. People are confined within their, respective apartments. But outside Hubei, like in Beijing, I can tell you, the public transport and everything are going on quite well. I mean, the transport flow is fine, but people are not getting out of their houses because the schools, colleges, offices, all are closed at this moment. Because the timing was actually wrong, because when this epidemic started, so that time the Spring Festival began. So that's the largest like human migration, taking place around that time. So that's why, people have gone back to their hometowns, villages and all. So people are confined within their household. But in Beijing, what I can see is like 300 odd subway stations, metro stations. In each of the metro stations, there are people wearing hazmat suits and using thermal scanning device to check each and every passenger. Like if China has responded to this problem quite slowly, but and they have wasted a bit of time, I would say. But after that, the way they have picked up the entire thing, like the way they are doing, they're leaving no stone unturned. That's phenomenal, and I think that's the best way a country could have like responded to such situation. So in Beijing, every office, every household, even where I am staying right now, my household, the apartment block, it's been sanitized every day, like with disinfectant. People are coming, taking temperature measurements with their thermal devices. I'm sure, like, in India, you may not have so many devices available, so many hazmat suits available, so many masks available. But here, and they built a hospital in 10 days flat.
That is
in
true.
India, we have seen like a file going from one table to another takes more than 10 days. And here you have built a hospital in 10 days.
Yeah.
So these kind of like, I mean, their operations on war footing basis is on. And at this moment in Beijing, is pretty controlled. I won't say there is no scare, nothing. People are not going out.
It's a different thing.
But
fear is a different factor. Fear is a different factor, and fear can be anywhere. But the point is to restrict it at the earliest. Make sure that there is no spread. Another important thing to remember is, like I said in the beginning of the show, that the percentage of fatalities are very, very low. So that should be kept in mind.